What are the side effects of chemotherapy and immunotherapy? The problems with seen during chemotherapy and immunotherapy. Chemotherapy is designed to kill fast-growing cells. However, the fast-growing healthy and normal cells like epithelial cells of our skin and intestinal mucosa can also be a target of chemotherapy. In immunotherapy application, healthy cells can be attacked by the immune system like cancer cells. Both conditions are the main cause of undesired side effects during chemotherapy and immunotherapy. Most side effects improve after chemotherapy and/or immunotherapy are stopped. However, it may take months or even years for the complete recovery. The most common side effects seen during chemotherapy and immunotherapy are: we can summarize it as feeling tired, diarrhea, nausea, vomiting, loss of appetite, weight loss, itching, skin rashes, urticaria, irregular fever, night sweats and sleep disturbance. What are the most common side effects during chemotherapy and how can we deal with them? Mouth and throat problems. Dryness and painful sores in the mouth. Taste and odor changes. Gingival problems. To cope with mouth and throat problems, see your dentist at least 2 weeks before starting chemotherapy. Keep your mouth moist. You can keep your mouth moist by sipping water, sucking on ice cubes or chewing sugarless gum. Brush your teeth, gums, and tongue after every meal and before going to bed. Choose soft, easily chewed and swallowed foods. Rinse your mouth 3 to 4 times a day with mouthwash solutions consisting of warm carbonated water. Nausea and vomiting. Nausea and vomiting can occur whilst receiving chemotherapy or hours or days after you receive it. Medicines called antiemetics can help prevent nausea and vomiting. To cope with nausea and vomiting, do not eat for at least 1 hour after chemotherapy. Eat small and frequent meals. Diarrhea. Diarrhea means frequent bowel movements that are soft, loose, or watery. To cope with diarrhea, eat 5 to 6 smaller meals instead of 3 large meals a day. Drink 8 to 12 glasses of clear room temperature liquids each day. Inform your doctor if your diarrhea lasts longer than 24 hours or is accompanied by pain or cramping. You may be given medications to control diarrhea and intravenous fluids if needed. Constipation. Constipation is defined as decrease in bowel movements and hard, dry, and difficult to pass stools. You may suffer from painful bowel movements such as gas, bloating, and nausea. You may experience stomach cramps, burping, and a feeling of pressure in your rectum. Chemotherapy and pain medications are also responsible of constipation. To cope with constipation, drink at least 8 glasses of water or fluids every day. Try to be active every day by walking, cycling, or doing yoga. Consume foods like whole grain breads, baked beans, raw vegetables, fresh and dried fruits, nuts, kernels, and popcorn which are rich in fiber. Infection. Some types of chemotherapy can affect the bone marrow, preventing it from producing new white blood cells, thus making us prone to infection. To cope with the infection, wash your hands with soap and water before eating and after using the toilet. ATM machines, shared phones, doorknobs, coins and paper money carry bacteria germs. You should stay away from people who have a cold, flu, measles, or chickenpox. Wash raw vegetables and fruits thoroughly before eating them. Measure your temperature at least once a day. Tell your doctor if you have a fever of 38 degrees Celsius and above. Fatigue. Fatigue after chemotherapy is a state of feeling weak, tired, heavy, and slowed down. Rest often doesn't help. Most patients report feeling exhausted during chemotherapy and for a few weeks or months after chemotherapy. The reasons for fatigue include type of chemotherapy, anemia, pain, medications, changes in appetite, insomnia, and other accompanying medical problems. To cope with fatigue, eat and drink well. Take time to rest. Be active but don't overwhelm yourself. Try light activities like reading, knitting, learning a new language. You can try praying, meditation, yoga and reading to relax and reduce stress. You can keep a diary of how you feel each day. Appetite problems. Chemotherapy can cause appetite disorders. Nausea and mouth sores, depression and fatigue can reduce your appetite. It is important to eat well, even if you do not have an appetite. If you do not eat well, you will lose weight, become sluggish and weak. This means consuming foods that contain enough protein, vitamins, and calories. To cope with appetite problems, eat 5 to 6 small meals a day instead of 3 large meals. Choose foods rich in calories and protein. Talk to your doctor and dietitian about what kind of appetite problems you have and how you can cope. Hair loss. Hair loss starts about 2 to 3 weeks after the initiation of chemotherapy. Your scalp may feel sore at first, then you may lose hair over time. Fortunately, hair almost always regrows 2 to 3 months after the completion of chemotherapy. To cope with hair loss, cut or shave your hair short. Protect your scalp from sunshine with berets, hats, headscarves. Skin and nail changes. Minor skin changes includes itching, dryness, redness, rash, scaling, hyperpigmentation, nail breakage and nail discoloration. Major skin changes, radiation dermatitis, and allergic reactions to chemotherapy, sudden and severe itching, difficulty breathing, rash, and urticaria. Most of these will heal after finishing the chemotherapy. To cope with skin and nail changes. For itching, dryness, redness, rash, and flaking, take short showers instead of hot, long baths. Wear gloves when washing dishes, working in the garden or cleaning the house. Wear light-colored trousers, long-sleeved cotton t-shirts and wide-brimmed hats. Do not expose yourself to direct sunlight. Nervous system changes. Chemotherapy can damage the nervous system. There may be burning, pricking, weakness, loss of sensation in the hands and feet. You may experience difficulty picking up or buttoning objects, hearing loss, stomach pain, constipation, confusion, and memory problems. To cope with nervous system problems, be careful when using knives, scissors, and other cutting tools. Hold on to the handrail while going up and down the stairs, and put a non-slip mat in your bathroom. Always wear rubber-soled sneakers or other shoes. Check the temperature of the water in the bathroom with a thermometer. Use gloves when washing dishes. Sexual issues. Chemotherapy can cause sexual problems. These problems are different for men and women. Chemotherapy may damage the ovaries in women. This can cause vaginal dryness, vaginal infections, discharge and itching, sexual reluctance, and early menopause. It can also affect hormone levels in men, can cause inability to orgasm, impotence, aversion to sexual desire, libido, and infertility. Infertility. Chemotherapy adversely affects the ovaries in women and testicles in men, may cause premature menopause and infertility. This means not being able to get pregnant for a woman and not being a father for a man. Bleeding. Tell your doctor if you vomit blood or anything that looks like coffee grounds, or if you notice dark or black stools or bright red blood in your stools. These may be signs of bleeding in the stomach or intestines. To cope with bleeding, brush your teeth and gums with a soft brush, use a mouth shower. When there is a cut, carefully press on it until the bleeding stops. Inform your doctor if you have bruises, small red dots, bloody stools, long and heavy menstrual bleeding. What are the most common side effects during immunotherapy? How can we deal with them? As with chemotherapy, the most common side effects seen during immunotherapy are feeling tired, diarrhea, nausea, vomiting, loss of appetite, weight loss, itching, skin rashes, urticaria, irregular fever, night sweats and sleep disturbance. We have summarized above how to deal with these situations. Additionally, during immunotherapy, inflammation of the lungs, pneumonia, inflammation of the liver, hepatitis, inflammation of the colon, that is, inflammation of the large intestine, colitis, inflammation of the brain, neuropathy, meningitis, or encephalitis, which affects the endocrine glands, especially the thyroid, pituitary and adrenal glands, and pancreas. Serious problems and kidney problems, including kidney failure, may develop. As can be seen, immunotherapy is a very valuable treatment method that stimulates and activates our immune system to recognize and fight cancer cells, on the one hand, and a treatment with serious side effects that can be life-threatening if not taken care of, on the other hand. How to treat or manage these side effects? In the case of cytokine release syndrome, or cytokine storm, drugs can be administered to block the activity of certain cytokine signaling pathways such as interleukin-1, Illinois-1, or interleukin. In general, most of the potential side effects of immunotherapy can be managed with early intervention. Therefore, it is important for patients to report any adverse changes occurring to their healthcare team as soon as they become aware.